Hello, and welcome to A Doctor's Diary, practical medicine for everyday clinical life. In this video, we are discussing a rare but potentially sight-threatening condition known as Acanthamoeba keratitis. Acanthamoeba keratitis is a rare but serious infection of the cornea caused by microscopic organisms called Acanthamoeba. These organisms are single-celled protozoa that naturally exist in the environment. They can be found in soil, dust, fresh water, and moist surfaces, especially in biofilms that develop where water is present. Although exposure to Acanthamoeba is common, infection occurs only under specific conditions. Acanthamoeba exists in two forms. The active form, called the trophozoite, moves across surfaces and feeds on microorganisms. Under unfavorable conditions, it transforms into a cyst, a highly resistant structure capable of surviving harsh environments. These cysts are resistant to drying, cold temperatures, and many disinfectants, which makes infections difficult to treat and prone to recurrence. The most common route of infection is indirect contamination through contact lenses. Poor hygiene of contact lenses, storage containers, or cleaning solutions represents the most important risk factor. In rare cases, infection may occur when contaminated water enters the eye, particularly when the cornea is already damaged. Even microscopic injuries to the cornea, which are common in contact lens users, can allow Acanthamoeba to penetrate deeper layers of the cornea. The incubation period varies widely. Symptoms may appear within a few days, but sometimes only after several weeks. Early symptoms are often nonspecific and may resemble other eye infections. Patients commonly experience a foreign body sensation in the eye, increasing eye pain, excessive tearing, light sensitivity, and blurred vision. As the disease progresses, characteristic findings may appear. Inflammation along corneal nerves can develop, followed by the appearance of a ring-shaped inflammatory infiltrate, which is considered a classic sign of the disease. In advanced stages, the infection may lead to severe keratitis, inflammation of deeper eye structures, increased intraocular pressure, and progressive loss of vision. Diagnosis requires specialized investigation. Samples may be taken from corneal scrapings, contact lenses, or storage cases. Laboratory confirmation may involve microscopy, culture methods, histopathology, or molecular techniques such as PCR. Early diagnosis significantly improves treatment outcomes. Treatment is often prolonged and may require both medical and surgical approaches. Medical therapy typically includes intensive topical treatment. In severe cases, surgical procedures may be necessary, including corneal abrasion, cryotherapy, or corneal transplantation, or the use of amniotic membrane grafts. One of the greatest challenges in treating this infection is the persistence of cysts. Even after symptoms appear to resolve, surviving cysts can cause recurrence. For this reason, long-term follow-up is essential, often extending several months after clinical improvement. Prevention remains the most effective strategy. Most cases can be prevented through strict contact lens hygiene. Important preventive measures include washing hands before handling lenses, cleaning contact lens cases daily, allowing storage cases to dry completely, using only approved lens solutions, and never storing lenses in tap water, replacing lenses and storage cases regularly, and avoiding water exposure while wearing contact lenses. In individuals without contact lenses, infection is rare but may occur when contaminated water enters an injured eye. It is important to note that person-to-person transmission has not been documented. This infection is typically acquired from environmental exposure rather than direct human contact. Although uncommon, Acanthamoeba keratitis is a potentially vision-threatening condition. Awareness of risk factors, early recognition of symptoms, and strict hygiene practices remain essential in preventing serious complications. If you found this explanation helpful, consider following A Doctor's Diary, where complex medical topics are transformed into clear, practical knowledge for everyday clinical practice. Medicine is learned from books, but real understanding comes from shared experience. Thank you for watching, and I'll see you in the next entry of A Doctor's Diary.